All right. Okay, so another framework that's another Australian one is for the Agency for Clinical Innovation. So it's a little bit more clinically based in an evaluation cycle, but I thought this was important as well because a lot of you will be going into health services and clinical health services from a public health perspective and looking from a clinical systems point of view. If it's working or not working in evaluation is incredibly important in that scope as well. So this one's a little bit more clinically based, but again, you'll see that there's an awful lot of similar themes that come across these frameworks that need to be considered in evaluation. So establishing evaluation team that's obviously looking at what your role potentially would be within that scope, scoping and researching around that, planning who has the responsibility, then key stakeholders, which we just looked at, and also defining that problem, those outcomes. And we're going to look at program logic a little bit more as a concept in a second. Then obviously the design, which we keep coming back to, what data you want, the implementation, how it's going to be, communicating and dissemination of results again. So I just wanted to put a framework in again that was a little bit different that you might come across in the healthcare setting, but again, you can really see those similar themes coming across. Okay, look, another similar theme that all those three frameworks have built into them that you'll see is the concept of program logic. So I thought we'd just visit this a little bit more now. And really, the term program logic is used interchangeably a bit with program theory or logical model or causal model, and it's really looking at the graphic depictions of the relationship between the program's activities and the intended outcomes. Okay, so you know, in that farmers market, we'll look at this a little bit more in a minute, but in that farmers market, obviously their activities are making people in vulnerable populations, low socioeconomic, able to access fruit and vegetables. It's then obviously going to increase their fruit and vegetable intake and obviously increase their chronic disease protective. And the whole theory behind that, which we all know quite well now at the end of a public health degree. So if we're looking at it from that graphic depiction that we just talked about then, you're really looking at starting off, okay, so what's the input, what's the background, what's the knowledge? That then directs the activities, okay? So all that background researching about, we know that if you have easy access to fresh fruit and vegetables, then intake of fresh fruit and vegetable is unquestionably higher. So that would have been the input, and all the scientific literature around that would have been the input. Then the activity that was designed was, okay, how do we go about delivering readily accessible fresh fruit and vegetable to these people that are often unable to obtain it due to financial restraints? Or we provide them with the financial ability to do this, but we don't provide them with money, but we provide them with coupons or a credit to be able to purchase this from fresh fruit and vegetable markets. Then the output then becomes, okay, so they did increase overall their intake of fresh fruit and vegetables over a certain period, and then what were the short-term effects for that? What were the immediate effects and what were the long-term effects? And that's where you can really track longitudinally what some of the outcome markers are. You might look at weight as a measurement. You might look at long-term chronic disease development if you're going for the long-term effects. And you might also look at long-term dietary patterns as well. So that's really what the concept of program logic comes back to, and that's when you then can look at how to fit in your evaluation across those time points, and that's why it becomes important. Okay, so this little chart here also just shows, you know, what some of the activities might be. Is it screening? Is it identification? Is it assessment? Is it training? And then what some of the outcomes are. These are sort of just generic public health concepts that you could or may be implementing and giving you some generic outcomes that you could be looking at, such as quality of life or developmental aspects within children. So it's just a nice little summative table there. This is another one that I thought was a little bit more of a worked example in terms of public health concepts that then looks at that program logic. Okay, so you've got your activities here, so you establish your program. I won't read through them all because you can do that in your own time, but you're looking at that program development, then what the actual program activities are specifically targeting. So are you targeting community action and social change? Are you targeting health education and skill development? Are you looking at capacity building within communities? Are you looking at supportive environments if you're looking at creating more of a breastfeeding supportive environment or something like that? And then you come across to the impact. So are you trying to increase someone's health literacy and knowledge? Are you trying to strengthen their interconnectedness or their social capital? Are you trying to increase their, built environment, their access, or, more footpaths for exercise and also their healthy lifestyle? And then that final column being the outcomes and looking at reduced inequalities. Are you looking at weight and those biomarkers? Are you looking more at quality of life and those more mental health scales? And then obviously paired with this, being public health, you can look at that epidemiological data of mortality rates and chronic disease morbidity rates over time. Those are obviously being very much a long-term, longitudinal marker. All right, so just to keep you from falling asleep, we've got another activity. And this time, again, using that previous example, and if you've got it with you, you can refer back to it or just think about it out loud, but try and, I'll break you out into your groups, but try and map out what some of the program activities were and what the intended outcomes were. Or you can also feel free to think of another example and discuss that within your group, okay? So I will jump out of the screen again and plop you in some breakout groups. All right.